Good afternoon, everyone. My name is Shannon Kupka with Comagine Health, and I'd like to welcome you to our half-hour Hot Topics series. These webinars are designed to support your efforts and provide you great ideas on caring for your residents in a 30-minute time frame to accommodate your busy schedules, and brought to you by the Comagine teams from Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. We appreciate you joining us. We are here to support you in the midst of this very stressful time, and we will be recording and posting this session for those unable to attend today. So a few housekeeping details before we start. Please go ahead and let us know who's on the webinar today by entering your name and facility in chat, as well as the names of any folks who are joining you so we have an accurate head count of participants. Your cameras and microphones are muted. If you'd like to ask a question, please enter it in chat, and we will facilitate a question and answer session at the end of the presentation. And when you chat, please make sure you're doing so to all panelists and attendees. We are delighted to have Dr. Kennedy back with us after a great presentation last month. She's going to be talking about recharging compassion and minimizing burnout. So Dr. Alexis Kennedy is a trauma researcher at the University of Nevada, Las Vegas, and the founder of Compassion Recharge. She is a forensic psychologist who has worked for decades on the issues of child abuse, sexual violence, and human trafficking. Her research and teaching for the past 6 years has been focused on the cumulative effects of working with victims and people in crisis. She works with first responders, healthcare workers, and other helpers throughout the United States and Canada. I will now turn things over to Dr. Kennedy, and let's just do a quick test audio with the group. Dr. Kennedy, can you say hello?
Hello.
Can somebody please just chat that you can hear that? Okay, great. Dr. Kennedy, you may get started.
Thank you. Thank you so much for having me back. So today, I know last time I started with the question of how are you doing, because life is very different now than it was a few months ago. But what we probably are still experiencing, that everybody experienced, is biting off more than you can chew. And it's something that people in the helping professions are very much guilty of, because we want to leave our best at work and manage everything at home as well. But it's important for us to sometimes stop and say, how many nuts are we trying to stuff in our mouth at once? So I like this image. So hopefully, it's always a little bit difficult to talk about sort of big picture compassion fatigue when we're in a crisis moment. Often you want to sort of focus on the immediate, more urgent needs rather than talk about the sort of long term. But unfortunately, this crisis right now is a long-term crisis. It's a marathon, not a sprint. So we have to figure out ways that we can stop and set aside the immediate and the urgent and think about the important and the long-term stuff as well. And I just wanted to remind you from that last talk, we're not quite ourselves right now, psychologically speaking. Having this huge sort of psychological crisis, I mean, obviously it's a physical and health crisis as well, but it's also a mental health crisis, with the uncertainty, with the numbers changing every day, with the progress and then stepping backwards and thinking we're coming out of it and having to re-step. This really is changing how we handle everything else, because everything we had before the crisis started, our worries, our family, the things that we're trying to juggle, they're all still there. But now they've got this added element of us trying to understand, how are we going to cope? How are we going to survive through this crisis? And what's left the green for us to sort of grow and do new things and create new situations is a lot smaller than we realize. So again, it's very important to be nice to yourself. And what you will probably be finding is how you feel about your job is changing throughout this crisis. It always happens in crisis situations. And it's something that if we understand why it's happening, you'll be able to sort of step back and look at it and figure out if this is permanent or a temporary change in the way that you're feeling about things. So really the goal of this talk is for me to give you a lot of definitions about sources of stress. And a lot of people don't like to think about the stress that they're going through because it feels overwhelming to sort of set out what it is that you're facing. But the more you understand about what you're juggling, the better you'll be able to sort of take an assessment and figure out what you can ask for help with, what you can set aside for a while, and what you really need to focus on. So we're going to go through some definitions of compassion fatigue and sources of stress, and we'll end with a few strategies on how to sort of recharge in these difficult times. So compassion fatigue was really defined in the nursing field, and one of the quotations that a lot of us that work in the compassion fatigue field love is this one from Kitchen Table Wisdom. And the quote being, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." We go into helping professions because we care, because we notice people in crisis, because we want to be useful. But to think that we're not going to take that home with us, that it's not going to become part of what we think about, what we worry about, the way we look at the world, that's really unrealistic. People who can shake things off and not take work home with them don't tend to be the people that go into helping professions. And we just have to be honest about the fact that our jobs stick with us. The clients, the people we're working with, we worry about them on off hours, and we worry about how effective we can be. And that's going to change both how we feel about our job, but also how we feel about our life and our social interactions. So being aware that that pressure is on us is a really important thing in helping us sort of bounce back and do a better job of managing it. A lot of the slides, sort of the source of the slides that I'm using today come partly from the compassion fatigue training program that Tend Academy runs. And if you've got people in your group that you think would really benefit to learn more about compassion fatigue or strategies for having a healthier workplace, I really encourage you to check out tendacademy.com. Since we're in a pandemic, a lot of the Train the Trainer programs are now online, but there's also an excellent resource, the Compassion Fatigue Workbook. So Dr. François Mathieu is the one who first trained me, and her workbook you can get on Kindle. It's just got amazing resources and activities and things. But if you think that this is something that your institution would benefit from, I encourage you to look at those resources or my website as well. So I wanted to give that shout out. But in terms of the academic world of compassion fatigue, it really came from the medical sciences, and it came from the nursing world. And a lot of times it was ER nurses who, they would be amazing at work. They would go in, they'd be able to make these life or death decisions. And then they'd get home, they'd collapse on the couch and not move until Monday. And they would say, is this all there is? Am I going to be leaving everything at work? And so a lot of the nurses that sort of wrote in this area, who sort of raised the flag about this area, it was the fact that they said, this just isn't good enough. I can't give my work 100% and have nothing left over for my family. As opposed to the ER doctors who tend to sort of go through the same crisis, but they just keep going. And if you keep going without finding that balance, you may be a really successful practitioner, but 2 weeks into your retirement, when your body finally gets a chance to relax, you keel over with a heart attack and there goes retirement. So there are people who never seem to miss a beat, never miss a day of work, and they're just so burnt out by the end of it. That's something also to think about. How is the stress that you're sort of managing at work affecting your physical health and your mental health outside of work or after sort of your career? And we talked, this will be familiar if you did the other one, we talked about this idea, but what does stress mean? Isn't stress just psychological? Stress is also physical. As soon as we see something that we're worried about, as soon as we recognize that something is off, our body has a physiological neurochemical response. And that's adaptive. When there were lions sitting in the jungle, and all of a sudden our senses went off and we realized that there was something dangerous out there, that was a good thing because it put our body into fight or flight. The trouble is most of our stress is chronic. If it's work-related stress, if it's people that, are needing our help and they need more than what we can give them, that's going to put our body into that same fight or flight as well. And that fight or flight means that certain systems go on, the things we need to be able to run away from a lion. So our heart rate going up, our oxygen increases, we send blood to our muscles, but we also turn off the things we don't need, the digestion, the healing, the reproduction. So that's why they've found now that people, when they retire, drop dead of heart attack. It's because being constantly in fight or flight and not getting to that healing and relaxation stage, it's like burning a candle. You're just going to burn through. And so many of our chronic conditions now are inflammatory, and they're very much exaggerated by stress. So when I talk about mental health issues, a lot of people are like, no, I just need to be better. I need to be tougher, strong mind. I really want people to understand how much stress is tied to your physiology, how much that takes a toll on your body, why it's okay to build in relaxation and it's okay to take care of yourself, because if you don't, your body is paying the price. And that's something that I think we're starting to see with this pandemic, people realizing, sort of hitting that exhaustion stage, because we've been in this mental health crisis for a number of months now, and people saying, well, why can't I get over this? Or why am I still dragging? Or why am I not enjoying work? It's because we're in this constant state of needing to do something, and there's not really anything we can do. We can't flee. We can't fight the world crisis. We can't fight an economy that's changing every day. So we need to understand that we have to be kind to our bodies as well as our minds for us to get through this, and to get through this healthy. And when I teach this to firemen and first responders, the policemen and that, they're all, tough and saying, well, I eat stress for breakfast. That's what gives me my edge. I love this stress. This is what I thrive on. And, ER practitioners as well have that. And that's okay. I mean, a little bit of stress is good. We need some stress so that we sort of get motivated and get running and get doing things. But constantly being washed in stress is going to have this effect that it will short our systems out. We don't respond well to new crises that come. And we'll see that. The people who were already feeling overwhelmed before COVID hit, it just pushes them over the edge. They had no resources left, no extra sort of space to do these things. So being resilient isn't being completely stress-free. Very few people are stress-free. And you'll see people who are in the most difficult jobs, but yet they seem to always have a smile on their face and always sort of bounce back. Resilience is just recognizing when there's things that are overwhelming you and being able to either say, let me set this aside for an hour and take a walk, or let me turn my mind to something else, or I've hit the wall with this task, let me focus on something else, and then maybe I'll feel better about it when I come back to it. So it's not that people don't have stress, they just recognize when they're in a sort of spinning their wheels, not able to make a change in that moment, or they're able to invoke their relaxed response. Our bodies are amazingly adaptive at getting us into fight or flight. As soon as there's an alarm going off or something dangerous, we're ready to go. But turning that off and getting back into relaxed, to breathing, to being able to tell your body, okay, it's a confusing time now, but in this moment, I'm fine. In this moment, I'm safe. That's something that we're not taught to do as well as we should. There's a lot of conversation around mindfulness and that, but how do we do this in a time of sort of chaos? The more you do it, the better you get at it. And that's really what the purpose of understanding compassion fatigue is. If you understand what are all the things that are sort of coming flying at you, you're better able to be kind to yourself and say, okay, this is a lot and I'm actually handling it pretty well. So the way I like to present the sort of sources of stress that we're juggling is in this idea that if we had a plate of stuff, sometimes one pile on our plate can get really high. And when we have one thing that's really sort of overwhelming us or more difficult or sort of taking up a lot of our headspace as we're trying to figure it out, it means we'll have less resources or ability to handle the other things. And we like to think that our lives are sort of this tidy plate of healthy things and that we're balanced. But really, for most of us, our plate looks more like Thanksgiving dinner, a little bit messy, a little bit delicious, but just, a sort of all over the place. And that's what I want to do in this session is sort of quickly walk through what are all the things that are on your plate or that you're juggling. So compassion fatigue is an overarching source of stress where really it's a measure of how well you adapt to difficult situations. If you have a difficult job, like for me, I always worked with, kids and victims in crisis. If you have a lot of people you're worrying about at work, I found when I got home and my kids were whining about something, I just didn't have that bandwidth to give them the sympathy they needed in that moment. Because if my work overwhelmed me, my ability to, watch horror films or to get sucked into family drama and stuff would very much be depleted. So compassion fatigue is this idea that either sometimes it's your home life that overwhelms you so that you don't have the same compassion, energy, excitement in your work, or it could be work. You've left everything at work and you have nothing left for relationships or home or things. So really it shows up normally either in work or in our home life. But it means that how you feel about your job, how you feel about your success in your job, how you feel about the clients you're supposed to be working with has changed somewhat. And most of us over our careers, they'll sort of go up and down, but there are going to be points where you feel like I've taken all I can in and I'm really not bouncing back, or I'm not as empathetic, or I'm not as sort of excited about my job as I used to be. And I think that is really starting to show with COVID, because people who really enjoyed their jobs, we're overwhelmed. We're overwhelmed with this idea of sense of, the world has changed. What's our new normal? When are we going to go back to normal? When are we ever going to see? There's just so many ifs and whats. that it's changing the way we feel about our jobs and changing the way we feel about a lot of different things. And that very much is compassion fatigue. So understanding that you don't feel the same way as you used to, or understanding that, you know, your lack of enthusiasm or your lack of patience isn't necessarily your fault is an amazing first step in being able to say, all right, I don't enjoy my job as much today as I did 6 months ago, but you know what? I might be back to enjoying it 6 months from now. So just allowing yourself to feel that lack of enthusiasm, or say, you know what, I'm fatigued, I don't feel the same way I used to, allows us to sort of say, okay, this could be temporary. Let's recheck in a month or two, or let me recharge in other areas so that I have more ability and things that I can leave behind at work. And one of the most important things with compassion fatigue is that the more you come to your job with in terms of your history of trauma, either childhood experiences or maybe victimization, because I work in the area of victimization. If you're working with people, maybe you're working with seniors and you've just lost a senior family member. I mean, what we're experiencing in our personal lives is going to affect how we handle the things that we're doing at work. So it's important to remember that everybody that comes to a job has a different background and a different sort of set of resources and strategies and things that they can use. And sometimes our coworkers, they'll be out of balance. Their personal history is sort of rearing up. And the more we understand about it, the better able we are to sort of say, you seem to be having a bad day, let me handle that patient for you. Or ask similarly saying, this person reminds me of someone, I just don't have the patience to deal with it, and swapping off things. So recognizing that we all come with our own histories is a really good way to understand why we may not be in our jobs in the way that we want to be in that moment. But we also get secondary trauma from our jobs, from the clients that we're working with, from the stories that we're hearing. And this happens across all careers. I mean, I do compassion fatigue training with judges and attorneys, and they'll say, I have certain clients with a certain case that just feels too close to home, or I had a really awful case 4 years ago, and this reminds me of it. We do take with us that sort of weightiness and seriousness, and we can become actually, you know, demonstrating signs of post-traumatic stress disorder from our jobs. I mean, we understand this with police showing up at car accident scenes, or firemen, you know, showing up at calls where they can't save someone. We understand that that takes a toll. Yes, it's a job, but it's also people that we connect with, people that we empathize with, and seeing these difficult situations day in, day out really takes a toll. It can change the way we feel about everything in our lives. So recognizing that we're getting secondary trauma in the health field now as people are passing away. Yeah, they might have passed away from something other than COVID, or from COVID, or they may have passed away even if COVID hadn't hit, but it's the magnitude. It's the fact that it's happening in every country and it's happening in every facility. That is a source of trauma. That is something that we don't just leave at the door when we go home. It's something that invades our daytime thinking and invades our nighttime sleeping, can cause nightmares. If that is happening, knowing that it's not your fault, knowing that this is something a lot of people are experiencing, allows you to sort of feel that grief, maybe talk to someone, maybe find a counselor, or maybe talk to people at work about it. But just recognizing you're not alone and that a lot of people are going through this really will help minimize that secondary trauma. And if you have a lot of primary trauma, your ability to handle secondary trauma can be interfered with. Some people who have a lot of primary trauma are really good at handling secondary trauma. A lot of helpers go into the field because they've been through it personally. But just recognizing that there's going to be some days where you have more or less ability to help, that really is a good thing to give yourself a bit of kindness. Now, sense of safety is something, if we go back to our basic needs psychologically, if we feel unsafe, that displaces everything. And normally before COVID, when I would talk about this, often I'd talk to like police officers and say, you know, when there's an officer involved shooting and you feel unsafe at work, it changes how you can make judgments. It changes how you feel about your job. It changes how you interact with the public. And they would sort of get that. Now we've got this COVID where nobody, no matter what your job is, necessarily knows if you're putting yourself at risk, if you could be exposed, if you've been exposed, or you can expose someone else. That takes up so much of our mental process, this idea of trying to understand what the risk is and whether we're at risk. Even the most minor things, getting groceries, doing sort of everyday tasks, that will displace everything else. And that's very much going to deplete your ability to handle all the other sources of stress. So know that COVID is this big thing that is at the forefront of our mind. Even if we can logically say, I'm safe, we're safe, this is, you know, only going to affect a certain percentage, it still is something that depletes your ability to handle any other source of stress. So compassion fatigue was sort of how you feel about your job and your ability. Job burnout is a little more specific. And this is this idea that you're just simply exhausted from the tasks of work, or maybe it's your coworkers. So absolutely everybody gets job burnout, no matter the job. If you're a barista at Starbucks, there's certain days where you're just like, I can't make another caramel frappuccino or something, or you're going into work thinking, I do all the work and none of my coworkers clean the bathroom. It's something that happens in every single job. And it isn't about that you don't like your job, the task of your job. It isn't about that you don't like maybe your coworkers. It could be your boss. You may love your coworkers, but you don't feel your boss is supporting you. Or you may love your boss, but you're mad that they don't have handle on coworkers who aren't carrying their weight. No matter what job you're in, there's going to be people who work harder than you and people who work less hard than you. And this idea of not being supported is really what job burnout is about. Compassion fatigue is sort of that more overarching, changing the way you feel about everything, but job burnout is very specific, that you like or don't like your job. And that will vary with time. It'll vary with positions, and it's something that we're seeing a lot more job burnout because people are balancing so much more with kids at home or worrying about elder parents or having all these other sources of stress. It means that the things that normally you could tolerate at work just bug you that much more, and that's something that we have to really be aware of. And moral distress, not all researchers separate this as another area, but because I've worked for so long with victims of violence, I find that this is almost a separate, bigger picture source of stress. And that's where someone who's trying to provide help, either provide therapy or services, advocacy, they know what their client wants. They love their client. They want to help their client get back on their feet, but there's limits. For me, I'll go work with the kids and they'll say, can't you take me home? There's a big part of me that wants to grab this kid out of detention and become their new parent, because I know exactly what they need, but I obviously can't do that. And when I say I'm trying to change the system, but it takes a long time to make these changes, or I run into them a year later and nothing has changed, that's a very frustrating thing. And that happens across all professions, where you like your coworkers, you like your clients, you like the job that you're doing, but there's limits in what you can do. And that often requires policy changes or income or money. And that moral distress can really stick with us, but we have to sort of step back and understand, well, this requires advocacy, or maybe we'll write laws, or maybe we'll lobby for different budgets. It's a very slow, big picture form of change, but it's definitely something that helpers sort of hit all the time. And with moral distress, often doing trainings or getting involved with groups or doing advocacy is something that gives you a little bit of work where you feel like you can make a change, but you just have to recognize that's a very slow change, as opposed to helping patients or clients, which can be an immediate change. And then none of us live in a vacuum, so we come to work and we try and leave behind what it is that we're dealing with on our off hours. For people who are working from home now, home life is totally collided with work life. So it's either we're worried about our parents or seniors or people we have to take care of, or our partners as we age, or it could be children. The fact that their kids are stressed, pets are stressed right now. Animals are starting to act crazy because they are picking up on this incredible level of stress that happens. So sometimes you've got a coworker who's normally totally on, and they'll all of a sudden come into work and they're snapping at everyone, and they're snapping at you. We tend to assume that there's something wrong with them as a person, their trait, but maybe their kid's in crisis, or maybe their parents in crisis, or maybe they've just lost someone important to them. We don't always ask what it is, but the more we recognize that, having these things that we have to deal with at home, it depletes our ability to bring everything that we need to bring to work. So sometimes we share our home life's ups and downs with people. In fact, research has shown that if you have an office spouse or someone that you're close to, that you can start your day by saying, oh my gosh, my kids are driving me crazy and blah, 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 and just take a few minutes to let go of that stress. Those workers are actually able to put that aside while they focus on their work, and then they can worry about it once they sort of return to the home life. So we don't want to talk about it all day long, but everybody's got their home life up and downs that really either increase or decrease our ability to stay out of that sort of compassion fatigue situation. And then there's also our friends. And a lot of people in the helping profession, certainly with the first responders that I work with and the medical people I work with, because we're used to helping people, we have a really high tolerance for people in crisis and lousy friends. And you'll know that because you'll pick up the phone to call someone and they'll spend 45 minutes complaining about whatever, and you don't get a word in edgewise. sometimes we have to look at our social system. And just because we're the only people that tolerate these needy people doesn't necessarily mean that we should stay with them as friends. A true friend is someone where you can debrief and they can debrief, and you can complain about your partner and they can complain about their partner, and you've got that back and forth. But as life gets more difficult, because we're in this compassion fatigue situation with COVID and work and everything, sometimes it's healthy to pick better friends, or to say, you know, I really enjoy my time with this person, let me call them, and not answer the phone when it's someone who's really needy who's calling. We're very bad at doing that as helpers, but it's a really important thing to keep yourself resourced, is to pick the right support system. And then finally, this one is one that's important, but when we're in times of crisis and we're feeling bad or we're feeling overwhelmed, we tend to go to our comfort foods. And if you look at the picture in red, I mean, that's just such a cheerful picture with all those bright colors and candy, but that actually is inflammatory and it decreases our ability to handle stress. The cereal with the fruit looks lovely, but in a pinch, most of us hit the drive-through or hit the junk food for that quick sugar fix and that self sort of comforting behavior. But research has repeatedly shown that the better our diet is, the better resourced our body is, the better we're able to handle psychological stress. So we want to actually eat healthy when we're feeling really overwhelmed, but that's the opposite of our sort of tendency to self-comfort through food. So that's something everybody knows. It's just a good reminder because, I mean, for me in a moment of crisis, I know where all the Dairy Queen drive-thrus are. That's my comfort thing. It's been a bad day, I'll have a mini blizzard. But I know that that doesn't resource my digestive system and my entire system the way that it could and it should. So it was difficult to do that in a quick half hour, but with the last talk, I talked about strategies for dealing with stress, and it's the exact same strategies for dealing with compassion fatigue. If you sleep, your body's going to perform better, you're going to handle stress better, it'll reduce anxiety, but of course it's difficult to sleep now because of all the stress. Being kind to yourself. The fact is, if you don't take care of yourself, you cannot take care of others. And I know people say that, but we very rarely repeat it to ourselves, and especially in times of crisis. You know, it's all hands on deck. We're going to be the super person that takes care of everyone else, but if you don't take care of yourself, you're not going to be able to do your job, and you're not going to do your job as well. Finding that social connectedness, calling people that really recharge us, making reconnections, that if we're stressed and worried about work, having a distraction and displacement and talk about something else is one of the best boosting, recharging things that you can do. And listening to your body. I do a lot of work with 911 dispatchers. When they have a bad call, what their strategy often is that we've come up with is put the phone down and just go up and down the stairs twice. Do a quick sort of releasing that stress, thinking about the call you just had before you get back into the next call. So listening to your body and giving your body a break is so incredibly important. Going outside, I mean, it's summertime, it's too hot in some places, but just being in nature, even if I'm from Las Vegas, so our nature is totally artificial, but walking along the artificial grass and seeing the palm trees, that's just really recharging for the body. So I can't take away anyone's stress. Everybody's got a lot of stress, but the antidote, the solution to stress is realizing all the things that you're juggling and taking an inventory and saying, you know what, I have a lot on my plate. I'm going to skip that call, or I'm going to say no to an extra shift, or I'm going to build into my schedule something that's good for me. Self-care is what allows you to go back to the stress, to start dealing with it again. And if you don't know what you're juggling, you're not going to understand why you feel so overwhelmed. And it's like having a to-do list. If you actually look at, well, what am I dealing with at home and at work and with limitations in my work and budget stress, and if you make that actual list, that's one of the best things you can do, because when you look at that list, you may have all of these piles of stress, but some of them you'll be able to minimize, some you'll be able to say, you know what, I can't change that. I'm just going to have to let it be. And making that decision to sort of let it go and say, this isn't something I can fix right now, I'll revisit it in 6 months, that actually relieves your stress. So it's like if you're in debt and you feel overwhelmed and you don't want to know how much debt you have, sitting down and figuring out all your bills is the only way to make a change. And for compassion fatigue, we're in difficult jobs, we're in difficult times, but realizing all the things we're juggling and trying to figure out what we can ask for help with or what we can put off till tomorrow, that's the best thing that you can do. So I recommend going to the ProQual.org site. They have a self-test that you can do that's a compassion fatigue sort of test. And it looks at both the trauma that you're getting from your job and burnout in terms of your working conditions. but it also measures your compassion satisfaction. And that's something that people who stay healthy in really difficult jobs do. They'll start their day by saying, what is it I love about my job? Why did I get into this job? Who did I help yesterday? A lot of times for me, I mean, the negative is what we notice. So I can have, 100 good reviews from a group of students, and it's that one bad review that sticks with me. And I forget to look at the 100 good, or I forget to give as much mental time space to the positive, because we're so drawn to the negative. So if your job is difficult, remember someone you've helped. Remember a moment of laughter. Remember something where you did a good job, because we tend to always look at the negative, and looking at the positive is what will very much recharge us. So to stay healthy in your job, you want to reflect on your successes. How have you made a difference to others? It's something that can become a habit that we do at the beginning of the day, or it can be a habit that we do at the end of the day. But it's something that's very recharging. I just made it in time, so thank you. I know I spoke really quickly. I've got more information on my website as well, but just most important takeaway, be kind to yourself. These are difficult times.
Thank you very much, Dr. Kennedy. I'm getting a lot of comments about that. You're just spot on and have given people a lot of great food for thought. I know we're at the top of the hour, but we're going to hang in for just a couple more minutes for any questions that we have, and maybe to cover a couple of comments. While you're thinking on these, I just wanted to share our new Comagine Health initiative with folks on the call. We are embarking on a partnership to reimagine healthcare, and we're working with providers across all care settings on things like improving patient safety, infection prevention, improving access to behavioral health, opioids, improving care transitions. So providers who join the partnership will receive a range of support, including expert coaching and technical assistance, education and resources, and access to their performance reports. This is all at no cost to providers, and joining is as easy as putting your name and organization into chat, and we can enroll you. So if you found benefit from our hot topics today, or another time that you've joined us, prevention gems, having access to your reports, please join us. We'd love to work with you. So we have Adrian put in chat where you can locate our hot topics webinars from 2020, and also on our website we have a number of hot topics webinars. We're going to try to get through at least a few of these. So Dr. Kennedy, we were asked about the possible sharing of the workforce burnout assessment, and I want to point out to folks that Shaza has commented that she's developed a 3-part Survey Monkey assessment, but she'd be happy to share. So can you comment on whether that's a shareable thing, or whether you could point to any resources?
Well, the ProQual website is a compassion fatigue measure that you can take as many times as you want. It's totally public, and all the research related to that in terms of job burnout and compassion fatigue are all on their website available for free. And then Tend Academy that I put up as well as my Compassion Recharge. Tend Academy has a blog and a lot of strategies right now for staying healthy. When I do this training, I often go into workplace and toxic environments and supporting each other and red flags. So there's lots of information out there. The trouble is now there's almost too much information, so it's sort of nice to get these little bite-sized pieces, but there's just a lot of great information out there publicly available.
And we could probably copy some links into an email and send it out to folks who attended, if that makes things a little bit
Sure, I'd be happy
easier.
to share some links.
Oh, wonderful. So we had a couple of questions. There's so many comments because clearly you hit a nerve here. You're resonating with this. There's somebody that commented on being in a management or supervisory capacity. They have a hard time letting staff see their own fatigue and compassion, and that causes a lot of stress.
It is difficult. And there's a lot of thought around leadership now, because leadership has changed with this COVID crisis, because you're trying to support people, but we're all in this, we're in the same storm. We're in different boats, but we're in the same storm. So Tend Academy actually has some really excellent resources on leadership and just how to be a good leader. And being a good leader isn't never showing that you're stressed as well. People want to know that our leaders are taking care of themselves as well.
Definitely. Along those lines, there was another comment about how to help team members who have a lot of home stress, which is affecting their work, because they have home stress that's causing poor performance, which contributes to work stress. So and people are out of paid time off sometimes. So in this situation, any thoughts?
Well, and a lot of it is supporting. So sometimes you can't necessarily take away the home stress, but by building in 5 minutes to sit down with that employee to listen to them on what they're dealing with, and maybe you can come up with some suggestions about, you know, if you ask for help from someone else, or so sometimes you just need to talk about what they're going through and knowing that they've been listened to. Also, sometimes you want to say, look, I know you're struggling, maybe we'll shift your hours, but we need you to be on at work as well. This is really difficult. Being heard is often empowering. So it's having those conversations and giving the people that are struggling a little one-on-one time and some brainstorming for strategies.
Okay. And again, I think you kind of addressed this, but any other thoughts on supporting staff who might be experiencing compassion fatigue, secondary trauma, and burnout?
Well, one of the things that happens is sometimes we need our coworkers to say to us, you seem to be having an off day, you're not quite yourself, how are you doing? People think they're handling it really well until someone points it out. And it's awkward because you don't want to be all like, there's something wrong with you and be judgy, but just saying, you seem to be really struggling and how are you doing? Asking that is sort of the intervention that people say, wait, maybe I'm not hiding everything I'm doing, or maybe I need to do less, or maybe I need to handle it. We need people to call out when our red flags are showing. And that's something that people are afraid to do, but you know, showing someone that you care and that you're noticing they're struggling is really empowering for them.
And to piggyback on that, there was a comment in here about people being able to speak about their fatigue and being honest about their own shortcomings in this.
Yeah, because we're all struggling and we've all got a lot on our plate, and to realize that you're not alone and that everybody's having moments of panic about no school in the fall or worry about their aging parents, just knowing that we're not alone, it makes us feel better.
Most definitely. So I'm going to not add to everybody's stress by taking us further into your day, because I know everybody's got to get back to what you were doing. I want to say thank you very much to our presenter, Dr. Kennedy, and really thank everybody for joining us. We're going to have our next Hot Topics on August 14th on presentation on adverse drug events with a wonderful pharmacist. And so I really would love to have you guys back. So thank you for all your efforts to keep residents safe and well cared for during this challenging time, and please take care of yourself. We are here to support you, so please don't hesitate to reach out. So thank you again, Dr. Kennedy, for another wonderful presentation, and we will let you all get back to your day. Thank you. This concludes our Hot Topics, and enjoy your weekend. Thanks for joining.